Thank you everyone for joining us. Welcome to the latest Duke media briefing on the COVID-19 pandemic. Certainly tired of saying that. I'm Greg Phillips with Duke Communications. Rising case counts of the spread of the Omicron variant have combined to introduce more uncertainty into this holiday season than many of us have been hoping for. With us today to discuss the current conditions and the role testing can play in making safe and responsible decisions is Dr. Thomas Denny. He is Chief Operating Officer of the 𝐓𝐡𝐞 𝐏𝐚𝐧𝐞 Institute and a Professor of Medicine at the Duke University Medical School. Dr. Denny, good morning.
Good morning, all.
So for the most part, we're going to be talking about testing today, as I said, but since the Omicron situation is rapidly changing every day, could you start by just summarizing what we know right now on transmissibility, severity of the virus, and how resistant it is to vaccines? What do we know at this point?
So thanks, Greg, for the question. So we're each day we're learning more. So the facts that I think we're fairly comfortable with is, number one, all of our testing modes that we have do pick up this new variant. All of the vaccines that we have, either be the mRNAs or the Johnson & Johnson, do provide coverage to this variant. However, there is some diminishing coverage, and in fact, some for example, the Moderna, we measure what we call a neutralizing antibody. It looks like the coverage is about a 50-fold reduction. However, if one is boosted, that is having the third shot, it looks like you have an excellent coverage to this variant. So the message here is to everyone: get vaccinated and get your boost as soon as you're eligible for that. And the hopes are that you then maintain the highest antibody coverage to protect from Omicron. The transmissibility seems to be much more increased compared to where we were with the so-called original novel virus that was first introduced to us. And then we stepped up a bit when we got to Delta. This seems to be a bit higher in terms of transmissibility. We think that people are being, if you will, symptomatic or showing the status of infection within about 1 to 3 days, where with Delta, we were looking at more 5 to 7 days. I would caution this a little bit as the numbers are still early. We're still trying to get an understanding on that. And that the last part is that it appears that the clinical course, or the symptoms, if you will, are a bit less for Omicron. Now, the one area that we're concerned about is if you have much more transmissibility and you get many more infections at any one point, then the chance that you can overwhelm the health systems just become that much more likely, because you have so many more people that are infected, and the chances that some will have complications, or higher numbers will have complications, are there. So the message, I would say, the short message here is: make sure you're vaccinated, make sure you can get a boost as soon as you can, and follow all of the public health protection guidelines that we talk about, such as masking and social distancing, even more aggressively perhaps than you were doing it in the last 6 months.
Absolutely. Thank you for that excellent summary. Certainly a lot to dig into there. And I'm going to come back to the first point you made about testing. You mentioned some encouraging news is that all of the testing that we have right now seems to be able to pick up the Omicron variant. But it seems there's still a lot of confusion out there amongst people about whether all tests are created equal and accuracy of tests. And as we move into the holidays and people are thinking about getting tested maybe before traveling or hosting people, can you talk a little bit about what we know about the difference between the available tests and the accuracy levels of each test involved?
Yeah, so our gold standard remains, and that is a PCR test. That's a molecular-based test that looks for molecular signature of the virus. That is the gold standard that we've been using throughout this whole pandemic, and it has the most amount of sensitivity and accuracy. Antigen tests are a step below that. In terms of sensitivity, they are very accurate, but their sensitivity levels can be a bit decreased compared to a molecular test. Having said that, most of us believe that testing is, the more testing we do, the better we are in attempting to identify infections. With the one caveat there: you have to always remember that testing is only a snapshot of today. So if I test if I had an exposure last night, I may not be positive today. I could have a negative test today and have a positive test tomorrow or Saturday. So people have to remember, keep in context of testing is related to when potential exposures could have been. And just because you have a negative test in any platform does not mean that you may not be turned positive in a day or 2 days or 3 days subsequent to that testing.
Sure, absolutely. Thank you for making that point. I want to come back to something you just mentioned about the sensitivity of tests. And you mentioned about how PCR tests are the most, or actually we go to the antigen tests, they're very accurate, but they're a bit less sensitive. Could you talk a little bit about exactly what that means? Because I think sometimes there's some confusion when people talk about, false positives, false negatives. So when we talk about a test being less sensitive, but still very accurate, what exactly do you mean?
Yeah, so when we talk about viral infections such as COVID, we talk about the amount of viral copies or how high a viral load is. When you do a molecular test, what you're doing is you're doing a Xeroxing, if you will, a copying of that viral signal that's in the sample so that you amplify the detection and you're more likely to pick it up. That gets to the sensitivity issue. When you're doing an antigen assay, you are not doing that. You are just measuring whatever virus is present in the sample with no amplification process. So if you have an infection and it's a very low level of infection, you may not pick it up on an antigen assay. The good news is about that is if it is very low, you are much less likely to be a transmitter. So again, one needs to keep in mind where and when different testing modalities or approaches bring value and where they bring some limited or some concerns about how you interpret it.
Sure, absolutely. That makes sense. We're going to open it up to questions now. Thanks to everyone who submitted questions in advance. We have a lot of those, and we're going to tackle those first. You can also pose questions via the Q&A window at any time, and I'll ask those out loud. If you'd like to ask your own question in person, raise your hand in Zoom, and we will unmute you when your turn comes around. If you're calling in by phone, you can raise your hand by pressing *9. I'm going to stick with testing for now because we've had a bunch of questions about that. And one concern that a lot of people have is they have family coming to visit, perhaps elderly, hopefully vaccinated, but elderly relatives coming to visit. You've mentioned about how testing is just a snapshot, and I wonder if you could share anything about a good strategy for people to be safe. If I have elderly relatives coming in, say on the 24th, should I get tested on the 23rd, the 24th? How can I use testing as part of a strategy to help keep my family safe over the holidays?
Yeah. So the first thing I would do is in advance of families coming together, I try to encourage all to be as aggressive as they can with masking and social distancing in whatever environment they are in prior to coming together. Also, hopefully they are all vaccinated, because if they're not vaccinated, then the likelihood of someone, being infected is just much more higher. The testing part of it, and this poses a challenge depending upon where you are and what you have access to in terms of testing. But the best would be to be tested as close to the time that you would be coming together as a family or a group of friends. And the reason there is that, as we talked about sensitivity in tests, if you are positive at that point and very infectious, you are probably going to be most likely be picked up with both tests, the PCR test and the antigen assay test. If you have a very, very low level of infection, you're surely going to be picked up with the PCR test, but you may not be picked up in the antigen testing platforms. But the good news there is your overall level of virus in you at that point is probably most likely below what we would say a transmitting scenario. So that if you did have a low level of virus, but you masked and you were around a group of other people that had been masked prior to coming in, the likelihood of transmission is low.
Gotcha. Thank you. And you've mentioned, obviously, we need to emphasize the importance of masking as part of this strategy. I'm wondering, because, people are gathering for the holidays, people want actual face time with their relatives. Do you think that in a group setting, an indoor group setting where relatives have come together from different places of the country, if those people have been masked during their journey, if they've been responsible about masking beforehand, do you think that families, when you're talking a dozen or more people, can gather safe and not wear masks when they're together? Or would you advise people to stick with masks during their gatherings as well?
I think every family has to come to grips with an understanding of what they're willing to accept. I personally think the more masking we do, the better. But the other part of this is in an indoor setting, if we can, in the holidays when we come together with families, we tend to want to be close to each other, give hugs, and just be very close. I think, given with where we're at with Omicron right now, that if we come together, perhaps we're not as hugging and close to each other as we traditionally are around the holidays, and try to provide a little bit of barrier there. And especially if people do decide that they do not want to mask with indoor settings within their family.
Sure, absolutely. Thank you. And then flipping the script to the other way, I've talked about people kind of gathering together and coming, like hosting people, but obviously a lot of people will be the ones doing the traveling. So obviously, as you've said, people need to mask, during travel and maintain distance where possible. How would you think about testing as part of travel? Should people get tested before they travel and when they arrive at their destination? How can testing be part of a safe traveling strategy?
Yeah, I guess ideally one would be tested before they travel, so they're sure they're not putting other people at risk, and then ending up in a setting where they've traveled to, and then they're stuck in the setting that they have to be with their family members. The problem there is the realities that we're living. You could test negative prior to travel, and depending upon how many days out that was from when you're going to be together, you could get exposed during travel, and be positive when you come together as a family. So it really takes a lot of common sense with people, of social distancing, masking, and deciding where they're traveling to, or where they're going to be for an event, and what testing they have access to screen. We had a wedding in the family within the last week. We had asked everyone to be vaccinated and tested 3 days before the wedding, and we had one individual that was scheduled to come that tested positive on an antigen assay, and was not at the wedding for that reason. So the pre-screening can be a very valuable tool. Acknowledging it is expensive to that people are needing to pay for testing in some circumstances.
Sure, and I appreciate you bringing that up. There are many countries that have been providing at-home tests to citizens for free and sending them in the mail. President Biden has pledged to make testing more widely available come the new year. Do you think that can really help? Obviously, as long as people are also masking and distancing, how much of a difference could it make if the government does make testing more widely available, assuming obviously that people are willing to use it?
I think the best thing we could do is have as many different testing platforms available that are covered by and that are not that people do not have to purchase, and you can have there's some good in-home testing assays that are out there, and then you have access to test centers where you can have the more elaborate PCR type tests done if needed. But the best thing we could do, testing has plagued us since the beginning. We got behind in the availability of testing early in this pandemic, and we've been playing catch up all the way along. We've gotten better. We don't have the supply chain issues today that we had a year ago or 18 months ago, but it still is a challenge with availability and access to testing that's not a financial strain on families.
Sure, absolutely. Thank you. We've got a ton of questions here, so I'm whizzing through as many of them as we can. We've had a question about, you mentioned testing that available people can buy to do at home. How can people choose a good at-home test? What kind of things should people be looking for? And the kind of rapid tests you see at CVS and Walgreens, are those the antigen tests you've been talking about, or are there certain tests that people should avoid?
Well, and I know this is a complicated response. The best way is for people to read and learn about the accuracy, the sensitivity, and the specificity of the tests that they're looking to use. And I would just say that the higher you are on sensitivity and the higher you are on specificity is the best testing platform. And that generally starts with PCR and then drops down a bit with every other testing platform or option that's out there. But I don't like to discourage, even if it is a low sensitive assay and that's all you have access to. I think that's better than nothing, and I would encourage use of it if that's all you can gain access to. And then hopefully, again, our goal is that we will continue to see the development and availability of testing platforms that have the highest level of accuracy and sensitivity, and hopefully either available via government support programs or insurance or low cost for individuals.
Sure, absolutely. Thank you. Getting back to holiday gatherings, you've mentioned obviously every family's got to navigate this for themselves, but certainly I know that there are some situations that might pose more or less risk. So I'm just going to mention some scenarios to you and just see what you think as regards whether people should be extra careful about hugging and close contact in these situations. So one we've had a number of questions about is if there are a large number of children under 5 who obviously aren't yet eligible to get vaccinated. Obviously, there's been lots of data about how common or how severe those infections are. But do you think people with small children in the house should be especially careful and especially vigilant about hugging and about masking, or does that not necessarily increase the risk? I know that's a tricky question.
Well, I think this is you could probably get a number of different opinions from people in the field. I think it's a good idea to try to do what you can do to reduce the risk there to those that are not vaccinated.
Sure. We're seeing with Omicron a big outbreak up at Cornell. Obviously, college students everywhere are going to be returning home from the holidays. Should people, especially, I guess, with very young people or very old people around, should we kind of be considering them maybe a slightly higher potential vector and be especially careful if there are college students in a holiday gathering?
I think they are a very good, likely source of vector of spreading infection during the holiday season.
Sure, absolutely. Thank you. Okay, lots more questions to run through here. One, we've got some questions about Omicron more specifically. Do we have a sense yet of how many positive tests in North Carolina are being sequenced to Omicron? Dr. Mandy Cohen obviously said the other day that rising cases in the state so far are all tied to Delta, cold weather, and Thanksgiving. Is that your sense too? And how soon do you think we might start seeing more Omicron cases being reflected in our state data? Or is it impossible to tell?
So I think the state of North Carolina is doing an excellent job right now with sequencing. We're part of a network that was assembled with collaboration with the UNC Collaboratory and funding from the state health department. There is a network now established across the state of the leading medical centers. We now are doing sequencing of any positive tests that we have in our testing systems, either be our campus surveillance system or clinical samples coming through a health system. And we're actively watching for, we've been doing this since the summer, so we're actively looking for the emergence of variants. We are still all Delta. And I think most of us feel that probably by the time we get through the holiday season, we will start to see significant numbers of Omicron present in our region.
Sure, thank you. And more generally, obviously, this year people were hoping to have more of a normal holiday season than last year. How concerned are you that the terrible timing of the emergence of this variant and the confluence of that with the holidays could really put us in a rough spot come January and February?
Well, it's a perfect storm in my view. It's horrible because and it's also going to bring challenges as we bring students back to campuses. Again, we have the perfect storm. We have a more transmissible, rapidly transmitting virus that is coinciding with a time when most of us are spending a lot of indoor time because it's cold. We're coming together as groups for the holiday season, and then in the process of all that, everyone is either traveling to or from a location in some part of it. So it's creating what I for me is a perfect storm that I do not see how we don't see a if you will, I hate the word explosion, but just a high rate of Omicron being present by the time we get to January.
Sure, thank you. Getting back to some specific holiday scenarios and advice, we're seeing almost all North Carolina counties, for example, are in the red zone, and we know that there are some counties and states that are suffering higher caseloads than others. How important is that as a factor when we think about holiday travel? Should we think carefully about whether we happen to be traveling to or from a place that's seeing higher case numbers right now and amend our behavior accordingly? Does that matter?
Sure. I think that's the kind of information that the families need to use in terms of how they strategize for the holiday season. So if you're living in an area that is very low prevalence of infection, then you have and everyone is staying within that area, not traveling from high prevalence zones to the lower area, that your likelihood of infection is reduced. But if you're living in a high prevalence zone, or you're traveling amongst a number of high prevalent zones, and then you're coming together in groups, and you have people that are not vaccinated as part of that, then the likelihood just increases with each one of those scenarios of a potential event.
Sure, absolutely. Thank you. You mentioned earlier that all of the existing vaccines do provide some coverage, and that getting boosted seems to really, really help with that. There's been some reports that Pfizer is working on an Omicron-specific vaccine. How much do we know about that? And are you concerned that people might delay getting a booster because they're waiting for that? What would be your advice to somebody kind of still on the fence about a booster because there's a new vaccine coming, potentially?
Don't wait. So yes, all the vaccine manufacturers have been they started working on variant-specific vaccines as Delta emerged, and they're continuing along that pathway. We here at Duke, we're working on a project that is called a pan-coronavirus vaccine. This is a vaccine that would help provide coverage against all the variants. Think of it if you're looking at a tree with branches and leaves. Today, we make a vaccine that covers some of the variants that are out there on the branches or leaves. We're trying to approach this by having a vaccine that would address coverage at the central trunk level so that you would not have this issue with all the different variants. Having said that, the current vaccines in terms of the Moderna or Pfizer are very good. They do provide coverage. What we know is that people's titers, if you will, their neutralizing antibody titer drops down about 2 to 4 weeks after the second shot. And that when you give the third boost, they come right up again and incredibly high. We have limited data though, what's the durability after that third boost of staying up. So we still believe that it's very good policy to have the boost. And if you had a single shot, Johnson & Johnson, I think most of us would say, probably get an mRNA type of vaccine to try to get your antibody levels up as high as we could.
Sure, absolutely. Thank you. So, staying with talking about Omicron for a moment, you mentioned earlier that at least the preliminary data suggests that maybe infections aren't as severe with Omicron, and that news is spreading quite widely. Are you concerned that that might make people not take this variant seriously enough?
Sure. And I think, again, we have to look at it. And we're just, again, so everyone has to keep in mind, Omicron is about a month old in terms of information we have right now. It's sort of hit, our early understandings of it on the Thanksgiving holiday weekend. So young people may do well, but older people may not. So as anything, the more infections that you see, the more we will get an understanding of in different age groups, in different settings, if you have pre-existing illnesses or some other underlying condition that you may have a more difficult time. The other thing I just want to point to that why it's so important to get vaccinated and use social distancing, masking and other things to slow down transmission. The more virus infects individuals, the more likelihood there is for the appearance of new variants. The virus wants to become more fit. It wants to evolve to a point that it evades the vaccine coverage. That's the natural tendency or the biology of a virus. So what we want to do is, while we're working to get people vaccinated to provide coverage and develop next generation vaccines or different medications to treat viral infections, we want to employ anything we can do to slow down transmission, slow down viral replication, because that will help us reduce the appearance of variants. And so far, we've been lucky in that, even though we've had a pattern of evolution with the virus from a milder type virus in terms of transmission to Delta that was provided very high viral infections, to now something that looks like it's highly transmissible, but the people are not getting as sick. We could end up with a virus that evolves from all this that escapes the vaccine coverage of what we have today, and that would be a disaster for society. So until we can get ahead of this, it is really prudent to policy to just do anything we can do to slow down transmission and slow down viral replication to prevent other more deadly viruses from evolving.
Absolutely, thank you. You also mentioned earlier that Omicron shows itself more quickly than Delta did, maybe 1 to 3 versus 5 to 7. Can that provide us with a tool? I mean, assuming obviously that there's enough testing going on to maybe, does that provide us with some hope that we might be able to contain the spread more so than we did with Delta, or the fact that there isn't enough testing makes that kind of moot?
Well, yeah, there's a balance there. Yeah, if we have a lot of testing and we can catch those infections, then we can again go to some of the public health measures of either of isolation and try to prevent transmission. The negative there is that if we don't catch them fast enough, well, they're transmitting and it's spreading. So it's a balance there of aggressive testing and being able to identify those infections, and then being able to implement some sort of public health policy that would prevent transmission. When you had a longer incubation period, such as with Delta, if you were doing repeated testing, then you had a more likely opportunity of picking up that infection before their viral burden became too high and they became a transmitter. So you had an ability then to identify them, isolate, and slow down transmission. So it is a bit more of a challenging situation when you have a very narrow window, as we're seeing with the current variant Omicron.
Absolutely, thank you. We've got another couple of questions pertaining to holiday gatherings that I wanted to run by you. First of all, obviously, there's been a lot of data out there that even vaccinated older people are at more, can be at greater risk than some unvaccinated younger people. If you have particularly elderly, vulnerable people that you're going to be seeing the holidays, is there anything else that you would recommend, or should we be especially more vigilant about not hugging and masking if we're trying to protect particularly elderly, vulnerable members of a family at this time of year?
I can tell you, I mentioned to you earlier, we had a wedding in the family. We had about 120 people. We had some people that were in their 90s, and they did not come. We said that we didn't want them, and out of an abundance of being cautious. So I would say, if you're going to be with grandmoms and grandpops or aunts and uncles that are elderly, I would suggest to be even cautious. Mask or again, maybe not hug and get as close as you would normally want to do with your loved ones and your family at this time.
Absolutely, thank you. Another question we've had is whether you provide anybody with advice after travel and after the holidays and everyone's returned home. Is there a checklist or particular steps that somebody who travels should take, even if you don't know that you were exposed? You know, what kind of things should people do if they just want to be extra careful afterwards? Is there anything?
The same policies that we're saying pre-travel, so you come back, think about who you're going to be around, and exercise a little caution till you're sure you're over a period of when infection would occur. If you have access to a test, it's probably not a bad idea. When we open up the campus in January, we're going to be doing aggressive testing of all the students coming back as part of our surveillance program, with the idea that we're cautiously optimistic that if we identify infections, we'll be able to stay ahead of this early on and not end up with a massive number of infections. So it remains to be seen. Will we be successful with that? But that's our hope, an aggressive testing policy. So I would say, yeah, you come back to your home setting, think who you're going to be around, if they're vaccinated, if they're not vaccinated, and use a little caution for a few days.
Absolutely, thank you. And I appreciate your willingness to restate some of the same points. These things can't be said often enough, and it's when the advice needs to be the same, we need to reiterate it. Some more questions here. At the beginning of the pandemic, there were the numbers of positive cases in a community was kind of everywhere and easily accessible. These days, where are you going, or where would you recommend that people go if they want the best numbers for cases in their community? Are there kind of state level resources, or is the CDC the best place to go? Where would you recommend people look for accurate numbers?
Yeah, so two things. One is you can find very easily Johns Hopkins website that tracks numbers every day by the state and by locality. Wherever you live, you can go on there and see what the numbers look like. Typically, your state health departments will have a website, and Johns Hopkins has been having this program in place since the beginning of the pandemic, where they pull all the data daily from the CDC, from state health departments. So it's one of the best trackers to look at new infections, hospitalizations, death rates. And it also provides what is an important figure to look at, is what we call the 7-day rolling average. And that is that when you're doing this, when you're tracking the numbers like we do, you can see spikes that occur today, and then a number drops off tomorrow, and then it'll pick up again on Sunday. So what is important to look at is what's a so-called rolling 7-day average. That gives you a sort of a comprehensive look at that region and that area and what they're seeing with respect to new infections, hospitalizations, or death rates.
Absolutely, thank you. Question we've had here, that vaccines are obviously the first line of defense, but the question asks, has the US approach been too one-dimensional this past year? Do you think that there needs to be more emphasis, I guess, on masking and social distancing as well as vaccines?
Yeah, I think we need, I look at it that in a way that we need as many tools in the toolbox as we can that we can get access to, and the first part of it is, for me, is the easy part, the public health approach. So the masking, social distancing, just being smart about where you go and how you interact with people. Second part is the access to vaccines and being vaccinated and then being boosted. And then the third part is we're getting close to it now, with both Pfizer and Merck having approvals of medicines that are antiviral medicines. That is, that if you get infected, you can be given this medication to slow down the viral replication. The key with those is that you have to start them fairly soon after infection. So if you get to the point of feeling sick, it's more prudent to get tested to make sure you're negative or positive before you get very sick, and then have less of a chance of having some of the medications that have been newly approved to be effective for you. The other part I'd say, we've had monoclonal antibodies as a treatment tool. There is some concern that some of those right now are less effective, or maybe not at all effective against Omicron. So there's still some data that's being generated there. But ideally, we want to have a number of tools in the toolbox that we can use to apply to different scenarios to help get beyond this pandemic.
Thank you very much. Couple of follow-ups to that. So you mentioned obviously the importance of public health guidelines, but we've seen public health departments in several states get kind of kneecapped by governmental by kind of requirements from governors to not have any mandates. How concerned are you that those are really kind of inhibiting the power of public health departments to do what they need to do in state-specific scenarios?
I've been concerned since the beginning. I come out of 30 years, 35 years in the HIV field, and we need to keep when you're dealing with public health emergencies, we need to treat them as a public health emergency and not politicize them. And I think the unfortunate part of this pandemic is early on, we politicized whether or not, wearing a mask was good or not good. And that just unfortunately set us out on a path that we haven't been able to recover from. So I would just hope that we don't politicize responses to this pandemic or future ones, and that we follow good science and good public health policies. The other part of that, and I know I hear people say, well, you guys say one thing today and you say another thing next week. What the public needs to understand is science is evolving facts. We get a set of facts and findings, and we make what we believe is the best judgment today based on those facts and findings. A week from now or 2 weeks from now, we may have another set of facts and findings that call upon us to revise or amend decisions we made earlier. That's what happens with science. And when you're dealing with what this is, this is a war. We're in a war with something that is changing constantly, and we just have to be able to understand what we need to do, and we really need to be able to communicate this well to society.
Absolutely, thank you. And we're closing in on 2 years since this pandemic started. I wonder if you could talk about where we are now versus where you thought we might be, what has surprised you in either good or bad ways about this, how this has unfolded.
Yeah, so I would have 2 years ago, I would have said that we would be beyond it by now, and unfortunately, we're not. I'm very disappointed at overall society's reaction to masking and public health policies. I'm very disappointed at the amount of vaccine hesitancy that's there. I'm just concerned how we find our way out of this, because it's clear if we can't get the vaccine rates up, we're going to continue to see some of these surges. I mean, two things can happen with the virus. It can mutate itself to become a weaker, less disease-causing virus, as what happened with SARS-1. It just disappeared because of good public health containment of it back then. Or it can continue to evolve into becoming a more aggressive and menacing pathogen to society. And we have to keep that in mind, and we just have to use every resource and every tool we have to suppress it if we want to get back to a way of living that we had, in 2019.
Absolutely, thank you. And I appreciate your willingness to talk yourself hoarse with all these questions. Got a few more here before we wrap up. You mentioned the tools in the toolbox and needing to use them all. We've had a question related to that. Does it, heading into 2022, how powerful is it that we have more tools in the toolbox? Based on what we know about how viruses evolve, can we make any predictions for what the pandemic will look like over the next 12 months?
I truly hope that we are going to, going into 2022, turn the corner. But what we have to realize is this virus is going to become endemic. It's not going to be eliminated from society. So there's too much of it there. And it's too much of a part of this. So we have to learn how we're going to deal with it and how we're going to prevent severe disease. About the only tool we have right now to prevent severe disease is the vaccines that we now have. Hopefully, we will get another generation of vaccines in whether it be 22 or 23 that will prevent even transmission of the virus, or certainly not require us to have so frequent of a boosting. And until then, I think we're going to have to remain on guard and utilize good, sensible public health prevention techniques to help get us through that transition.
Sure. Thank you very much. We're going to wrap up here in just a second. I just wanted to come back to the idea of holiday travel. Last year, a lot of the guidance was just don't gather, don't travel. We didn't have a vaccine. Given the emergence of Omicron and the fact that vaccine levels aren't where they need to be, would you suggest that people seriously consider just simply not having holiday gatherings last year and maybe looking at what we did last year, which was in large part actually not gathering for the holidays at all?
So if I was in a setting where no one was vaccinated and I had, I would certainly think of that. In a family that's fully vaccinated and willing to exercise some caution, I think we can have some family gatherings. Having said that, I clearly this new variant has thrown us a curveball at the worst possible time that we're all dealing with. So I think a lot of people are rethinking how they will get together and what they will do. Again, I tend to try to say every family has to decide what's the norm for them, what they're going to be what they're comfortable accepting. Are they comfortable accepting coming together and the potential risk of young children or older individuals becoming infected and potentially having some serious disease, and if they're not comfortable with that, then they need to think of not coming together. If they're comfortable with those approaches, then they come together as a family and they've collectively agreed that that's that's what the rules, if you will, for the holiday season is for them.
Sure, absolutely. Thank you very much. We're going to one more question here before we wrap up, and it's an opportunity to restate a point that you alluded to earlier. Nobody enjoys wearing a mask, and we see a lot of people that kind of dismiss masking as a strategy. Can you talk just for a moment about how important masking is and the fact that it can really make a huge difference to transmissibility?
Sure, and I'll be the first to say wearing a mask is uncomfortable. I did a lecture 6 weeks ago, and for 90 minutes I had a mask on, and it's there's no question about it. It's not comfortable. We know that virus is in nasal passages and oral cavities. When you have a mask on, you're doing two things. If I am infected and I am wearing a mask, I am slowing down or reducing the potential of virus to come out and reach someone else. When my family member or my neighbor or colleague is sitting across from me and wearing a mask, they now have a barrier so that if something does somehow get away from me and my masking, it makes it harder for it to enter them. So by both parties masking, you have essentially put up double barriers and really reduce the risk of an infection occurring or transmission occurring. So it works effectively on both sides of this issue. The one that's infected by slowing down the amount of viral particles that can be released from them, and the one who is not infected, it slows down the potential risk of them being exposed to viral particles.
Absolutely. Thank you, Dr. Denny. We will call it there. Appreciate everybody joining us. Thanks to our panelists, Thomas Denny, for sharing your expertise. If you'd like to be notified of upcoming briefings, please email dukenews@duke.edu. In the meantime, please stay well, wear a mask, and get vaccinated for the people you love the most, if not for yourself. Thank you, and have a safe and happy holiday season. Take care, everybody.